So next is my topic. I am Dr. Sharmistha Behera. I come from Orissa. I work in a medical college as a professor, and I took up this topic to discuss the importance of case discussion on the day of admission after OPD. It sounds very silly because it's only obvious that all the cases should be discussed on the same day. Let me admit, me also, like, I have become a professor, so just finish the OPD and go back home, and the next day I expect in the OT everything should be ready. So now these days we cannot give a gap of a day from the day of admission. It's my opinion, seniors are there to decide. A gap of a day probably would give ample time for evaluation of every patient before taking the patient to surgery or to continue with the conservative treatment, because many small things are missed out. Now again, what has happened, maybe I'm wrong, there are ample number of hospitals built only for BSK. In our state we have BSKY, that is Biju Swasthya Kalyan Yojana. So according to that, the government pays 7,725 rupees per phaco patient that is operated. So what is seen is, anybody like a non-doctor also builds up a hospital, and they do these surgeries in huge numbers and for the sake of money. So what is happening, the travel fare to the patient is given, and the patient is also given food. So they prefer to go to these hospitals rather than coming to the medical college. So what is happening these days, I was listening to all the discussions, this is my observation, we have very few patients to give hands-on to the students. The patients that come to us do not come primarily, they come to us only as a tertiary center. The complicated ones, they come to us, and very few, a very small fraction of them come to us for primary cataract surgery. So this is the scenario now. So once, and all of you will agree that the patient knows much more than the surgeon. They come up, बाहर तो एक ही दिन में हो जाता है, घर छोड़ देते हैं, it is OPD procedure, why are you admitting us? So that is also one thing. So when a patient comes, my contention is, if we give ample time to them and if we evaluate them properly, gain their confidence, gain their faith, and if then we go about it slowly, maybe that will help in all the academics and all the things. And I would not repeat with all my slides because everything is already discussed. My next speaker is, next discussant is Dr. Sucheta Parija. If anybody wants to say something, sir.
Actually, ma'am, you are very much right. Nowadays, very constrained, no doubt. But I tell you, this is the only the things which we in OPD we admit the patient, and suppose your OPD today.
Yes, sir.
So what I consider in my own time, the OPD today, definitely I used to see all the admitted patients same day,
Yes.
whether 2:30 or 3:30 or 4. Not only I instruct the residents what to do, like in my as a residency, there was a test bandage. I do not know, most of the people not heard the name of the test bandage. In the PG admission, when I asked what is the test bandage, all the PGs failed. I tell you, a very reputed institute, I will not name. What is the test bandage? Failed. In our time, test bandage just to put the bandage for 24 hours, next day open. If any discharge on the pad, it means the case is infective. They postpone the operation. You know, that is the test bandage. So at that time, we do the test bandage. Later on, it becomes the, as OPD, the pathology slide. When I become the OT, I am the PG student to the now the HOD, so what I started, all the postgraduates, after the admission, everybody has to take out the entire smear on the slide, get the microscope from the pathology department. I got it done, stain it by the Gemsa stain, I just look it, positive or negative. Anybody can do it. And the same resident started seeing the gram positive, negative. And if you feel there is positive, send it for the culture. Postpone the case. Other, with a negative, go for the operation. That is the way how we have started, you know. And there is very low, I tell you, in the Agra Medical College, we have more than the 30 to 40 doctor, especially having the volume of the surgery there in Allahabad Medical College. He used to operate about 2:30 in the night, being as a principal. He works as an officer also, academic work plus administrative work, and then the OT. So like that, all the persons have independent their own way, how to design their own department, like the family. If you are the guardian of your family, how to run your family. Similarly, the institution, the department, you are HOD, you are the person, how to run it, you have to develop. Learn from our seniors, learn from the colleagues,
Yes, sir.
and learn from the juniors.